Very common condition, kids play a sport and the ankle seems like a little swollen. They use the word sprained ankle. How do you handle a sprain?
Well, there is the most common condition we see in kids before they're done growing, when they invert their ankle, is actually an injury to the bone or the growth plate of the lower fibula. And so, whereas adults would commonly sustain a sprain or an injury to the ligament, that's fairly uncommon in kids, especially kids under 12. The treatment for this injury to the bone, or technically a type of fracture of the distal leg, the distal fibula, depends a lot on how symptomatic the kids are. So most we will give crutches to, and then and restrict activity. Now there's some kids with this injury, if it's a severe enough inversion, that have a great deal of difficulty standing and bearing weight. And in those kids I'll usually put a cast on for 3 weeks. There's also a number of times where bringing crutches to school is not easy. And in those kids I'll also put a cast on. But this injury is common and is usually resolved and have the kids back to normal activities within 3 to 4 weeks.
Is it kind of thinking, if you have a minor one, you ice it, the first set, do they have to immobilize for a long time, or can they get up and walk afterwards, or what?
I think in general in orthopedics, the less time we have to immobilize somebody, the better.
So the common thinking is get them up and moving as quickly as possible?
Right. We'd like to get them up. Obviously, they have to be able to get around, so if they can put weight on it, we'll let them walk. If they need crutches, we'll give them crutches. But the ones that I put a cast in are allowed to start walking and weight-bearing immediately.